What's going on, guys? My name is Oscar Ortega with Cream Digital. I'm going to walk you through our front desk AI infrastructure for a healthcare practitioner, in this case, a chiropractor. So we're going to break down exactly what we're doing, how we're optimizing his business, and how we're able to take specific tasks that his front desk staff was doing, automate those processes and or add AI to optimize his business and make it much more profitable. And we're going to walk through the numbers so you can see exactly what we're referring to, right? So let's get started. First and foremost, let's get started with the tasks that the staff was doing, right? So by and large, the front desk staff is handling call routing, collecting patient information, verifying insurance, scheduling appointments, managing paperwork, data entry, and communicating with healthcare providers. What AI is able to do or take off their plate in this case is patient information collection, insurance verification, which is huge, automated scheduling, document management, data entry. We can also automate the billing process as well, which is a huge time saver for these clinics. And let me walk you through the exact infrastructure so you know exactly what we're referring to. So this is the initial bilingual automated call routing. So this is a fully bilingual English or Spanish AI agent that is answering every single phone call. So no call gets missed. What the beauty of this is that not every single phone call that gets through to your office is important. Some of them are just basic questions. What's your address? Where can I park? What are your hours? What insurances do you guys accept? Like these questions can be answered by AI because we can connect it to a knowledge base to make sure that we can answer those questions accurately, allowing your team to focus on more important tasks, right? Furthermore, if they want to be routed to specific departments and or employees, we have what's called a warm transfer. So in this instance, we collect all the information, we summarize it, and we tell the employee when we transfer the call, you have a call by Oscar Ortega. He's looking to, verify his insurance billing or whatever that they're asking about, so that when that employee receives a phone call, they have full context as to what that individual is asking about. And they don't have to then ask those questions again, speeding up the entire process, right? For both the individual that's calling and also for the employee, maximizing their time. And the same thing goes for the department. We can automate or add AI for the intake process, the client intake process. Everybody has different questions they ask that are qualifying and or disqualifying questions when it comes to booking a new patient. So in this instance, we ask all those questions. We connect to your calendar. We know exactly what's available and what's not. And as we're working through those solutions, we're asking the questions to the client, getting the information, booking the appointment on the calendar, taking that information and adding it to your CRM or your EHR. And then we're able to automate the sending of onboarding documentation to these patients. So then that way, by the time they get to the office, they already have their onboarding paperwork. They've already been booked, all with AI. And again, the most important thing is this is 24/7, 365. So if you're running ads, for example, or you have referrals that are coming in after hours, this is huge because now you can run ads at a much more cost-effective rate. You can run them on weekends. You can run them after hours where there's less competition, still be able to get patients in automatically, right? And so here's some numbers that we know about the market overall. 40% of all appointments and calls occur after business hours. So if you're looking at it from that perspective, right, you're only open 9 to 5. You're missing out at the pre-9 o'clock calls, right? Let's say 7:30 to 9 a.m., post 5 p.m., right? 5 p.m. to 9 p.m. where people are out of the office. And then obviously on weekends, right? So if you can have all those hours that you can now have AI answer for you, it is huge. And so the other statistic that we saw was 85% of people will not call back if their first call goes unanswered. So again, if someone is looking for a local chiropractor or local dentist or insert whatever practice, right? If they're looking for somebody and they're calling and they don't pick up, 85% will not call back. So you're losing that lead. That's a lot of money that is potentially lost by not answering the phone, right? And so the way that we look at the ROI is one, what exactly is your individual front desk staff doing or admin staff doing, breaking it down by task, how important it is, how that basically applies to the ROI of your business. What can AI take away for you at a much more cost-effective rate? How many missed calls do you have? If you're answering only between 9 and 5 p.m. and then you have an answering service, maybe the answering service doesn't always do all the above. They might just take a message. And so it's not as effective as a kind of fully integrated AI system. So we take it also a step further. Once that appointment is set, to kind of mitigate the no-call, no-shows, we make sure that we nurture that appointment. We give them a call. We send them an SMS to confirm, reschedule, or cancel the appointment. If that appointment is canceled, then we go ahead and alert somebody on staff. Another statistic that we saw is responding to a lead within 5 minutes, it increases conversion by 9x, right? So if someone submits a form, right, on your website to book an appointment, if you're giving them a call within less than 5 minutes, chances of you booking that individual as a client is now up by 9x, which is huge, right? So in a way that if you just do the same thing you're doing for your business right now, you don't have to hire additional staff or learn new technology. If you just implement this system into your practice, it'll ROI significantly, right? Because now you're able to do so many more things than you would otherwise have to hire for at $20 an hour, $25 an hour, maybe more, depending on the task, the experience, and also you got to pay the taxes on that, etc. Maybe even medical costs. So again, all these things add up. The training that you have to do, the AI. We get the knowledge base, we get the questions, and within a few hours, you're up and running. We connect to your existing systems. And so this is a very seamless system to set up. Finally, the AI insurance verification, which is, in my opinion, one of the hallmarks of our business, right? What we do as an agency is able to program the AI agent to call the insurance company, work its way through the IVR system by physically, basically going, if it's asking specific questions about departments, it knows what departments to dial to, right? So if it's asking about the verification department or to speak to customer service, it'll know exactly what department to dial for. And then we have 2 steps in this process. If we get through to a human, we can then transfer the call to one of your front desk staffers to continue the conversation. We can also take it a step further and just ask the questions that need to get asked to verify the insurance information of your patient, get that information, gather it, and add it to your CRM, right? So that entire process can be done seamlessly. Whereas one individual can only make one phone call and it can take them 30 minutes, maybe even more, to get that insurance information verified. You can do 10, 20, 100 at a time. So you're able to verify information much faster and get to the part where you can start billing much faster, right? And again, if you're in the pain management space, which is also, pretty big space in the clinical world, the medical records request, whenever you have attorneys that request medical records, by and large, it can take a day or two to receive that information, have someone at your front desk and or admin staff go through all the individual files and send it to the attorney. That can take 24 to 48 hours. In our case, it takes 5 minutes, maybe 7. And so we have an automation that gathers it's a file that we have that the attorney receives. They put the patient's first name, last name, their date of accident, their date of birth, and that's how we match it to your medical records. We validate the HIPAA form to make sure that we can release these records to them. And then we go ahead and we can either send it to one of your staffers, so they receive the email, they can check, and then they can send it to the attorney. Or if everything checks out, we can automate it so that it goes directly to the attorney themselves, right? So this entire infrastructure, as you can see, can save you a lot of time, can optimize your business and really squeeze every single dollar of your business in your favor, right? And we can do so much more because obviously this is one perspective. Actually, we've done this a few times. So a perspective of a few different instances, but everybody's unique. And is there specific things that we can do with AI? We would love to take a look. If you want to hear what these AI voice dialers sound like, you can go ahead and check our YouTube channel. You can check on our website. We have a lot of different examples. If you want this system built out for you or you want to know more information, by all means, below this video, there's a link to schedule a call with us. And we look forward to speaking with you soon. Have a wonderful day.